This project, funded by Vic Health, was to understand the impacts of racism on health for Indigenous children and young people in Australia, and to really build knowledge in this area where very little research has been done to date. The research that has been done internationally has recognised that racism is an important determinant of health for Indigenous peoples and for people from other cultural and ethnic minority groups. But it's mostly focused on adults. So we really wanted to understand more about how experiences of racism affects health and wellbeing for Indigenous children and young people in Australia. Consistently across all studies, we found that experiences of racism, whether they were experienced by the young people or experienced by parents and caregivers, that those experiences negatively affected health outcomes for children and young people. Some of the studies that we examined looked at mental health or social and emotional wellbeing outcomes, and we found that those children and young people exposed to racism or whose parents had been exposed to racism, that they experienced poorer social and emotional wellbeing outcomes. And we also found in one of the studies that children whose caregivers had experienced racism were more likely to experience more common childhood illnesses. Well, the findings of this project give us some more information about how and about pathways between experiences of racism or caregiver experiences of racism and how those experiences impact on the health and wellbeing of Indigenous children and young people in Australia. And while we, of course, need to do some more research over longer periods of time, this provides us with information that will help in closing the gap in health and wellbeing outcomes experienced by Indigenous children and young people in Australia compared to other Australian children and young people, which we know is an important priority for us in Australia and an important priority for Vic Health's work as well.